Initiate. I am Dr. Professor Odontuya Davasuren from Mongolia. Today is my presentation about history and development of palliative care in Mongolia. Mongolia is a big country with territorium 1.5 million kilometers square. Population is very small, just 3.5 million. Average life expectancy for men, 67, for women, 76 years. In 2022, died 70,900 people about. Palliative care needs about 11,000 people per year. Situation in Mongolia before 2000 was very difficult. Mongolia had no palliative care organizations or hospices, had no education program on palliative care in medical schools. Government and Ministry of Health had no palliative care policy. There were not available essential drugs for palliative care. Opioid prescription was not appropriate. Mongolian Palliative Care Society established in 2000 with goal to improve quality of life for terminally ill patients by developing education, services, drug availability, and national palliative care policy. And for developing palliative care policy, Mongolian Palliative Care Society organized many conferences for health policy makers since 2000, 2006, and especially in 2002, Mongolian Palliative Care Society organized a leadership conference for palliative care advocacy, and participants of this conference were two parliament members, deputy health minister, presidential social policy advisor, international consultant Jan Schersworth, health directors from all provinces and districts, directors of all medical schools and media. As the result of this conference, in the end of the conference, all participants, 100%, were agreed to establish palliative care in Mongolia. And Mongolian Palliative Care Society organized a palliative care policy development conference, drug availability conferences several times, education on palliative care conferences during 2000, 2005, 2006 in the Ministry of Health, and by support of Open Society Institute. And as the result of these conferences, we have some achievements in policy development. Palliative care included in health law of Mongolia, health insurance law, social welfare law, medical services law, national cancer control program, approved palliative care standard, palliative care organizational standard, approved pain management guide. And now I want to talk about achievement in palliative care education. Mongolian Palliative Care Society organized basic courses on palliative care for more than 6,000 medical workers. Mongolian Palliative Care Society trained national trainers from all 21 provinces of Mongolia and 9 districts of Mongolia. And palliative care undergraduate training programs adopted by all medical schools in Mongolia. 245 palliative care doctors and nurses specialized at palliative care resource training center by 3 and 6 months training courses on palliative care since 2004 till now. Main WHO guides for palliative care translated into Mongolian language and published and distributed to doctors, nurses, and family caregivers, and voluntary caregivers. 30 palliative care books and manuals, 150 articles and abstracts published during last 23 years. And 2 doctors graduated PhD degree on palliative care, and 10 doctors graduated master's degree on palliative care. For public education, Mongolian Palliative Care Society distributed educational leaflets and calendars, 10 TV programs, and more than 45 interviews about needs of palliative care broadcasted by Mongolian TV channels. For public education, we use it World Hospice Palliative Care Day. Every year since 2005, Mongolian Palliative Care Society organized conferences, educations, advertisement, and advocacy activities during World Hospice Palliative Care Days. You can see the World Hospice Palliative Care Days photos since 2006 till 2011, since 2012 till 2017. Even during the COVID period, we organized online conferences. And during the organizing the conferences, we always published during the World Hospice Palliative Care Day, published the educational material book. And you can see this books, a serium of this book with the educational materials, report of this year, and the plan for next year. Now, I want to talk about development of palliative care services in Mongolia. Palliative care department in National Cancer Center established in 2000 by international donations and received health budget since 2005 and received health insurance since 2012. Now, palliative care department in National Cancer Center has 16 beds, inpatient unit, outpatient clinic, and home care services. Green Home Hospice, established in 2004 by support of Samuel Hospice of Korea. Green Home Hospice provides inpatient, outpatient, and home care services. Pastor Lee is a director of Green Home Hospice, and his wife Hannah is a manager. Grace Hospice, established in 2005 by support of international donors and American nurse, pastor, best medical worker of Mongolia, Helen Shepherd. She was a director of Grace Hospice for 10 years. Grace Hospice provided home care services. Since 2022, Grace Hospice opened the inpatient hospice service with 10 beds and changed the name to Compassionate Sight. Hope Hospice, established in 2005 by support of Mongolian Christian medical workers and provided inpatient, home care, daycare services. But since 2022, this hospice closed because of financial and staff problem. Agapa Hospice, established by support of Shimji Khan in 2014 and provided inpatient and home care services. Korean Dr. Hwan Tae Park is the director of Agapa Hospice, but now, because of financial problem, provide just home care services. Pediatrics palliative care ward with 5 beds was established by Ajagigen, Mongolian monk, in the Pediatrics Oncology and Hematology Center in 2014. Palliative care wards with 4 palliative care beds established by support of Cancer-Free Mongolia Foundation of First Lady of Mongolia during 2010-2015 in 21 states or IMAX provinces of Mongolia and 9 districts of Ulaanbaatar hospitals. Now, by order of the Ministry of Health, 2% of total hospital beds of Mongolia served palliative care patients, and all 21 provinces of Mongolia and 9 districts of Ulaanbaatar have palliative care wards. Even prison hospital in Ulaanbaatar have established 4 palliative care beds in 2010. Now I want to talk about achievement in drug availability in Mongolia. The consumption of opioids in Mongolia increased from 1.3 kilogram in 2005 to 10 kilogram in 2006. In 2014, Mongolia imported 40.8 kilogram morphine, 1.3 kilogram codeine, 1.1 kilogram fentanyl, and 4.3 kilogram pethidine. 99% of WHO list of medicine for palliative care available in Mongolia. The Ivy-Co, Mongolian pharmacy company, began manufacturing injectable morphine and pethidine since 2004 till now. Formerly, only oncologists had right to prescribe just 10 ampoules of morphine. But now, approved order of the Ministry of Health in 2003, drug prescription standard in 2004. In 2004, the national standard for prescribing practices was approved and changed the prescribing regulations to allow prescribing a 7-day supplies of opioid by family doctors and other doctors every 7 days until death. Generic immediate release morphine and sustained release morphine tablets were imported in 2006 from the West Coast Indian company at an affordable price. Now I want to talk a little bit about international cooperation of Mongolian Palliative Care Society. Rosalie Shaw, former director of Asia Pacific Hospice Network, organized 2 bedside training courses in Mongolia by invitation of Mongolian Palliative Care Society. I and Dr. Gantuya graduated from the International Fellowship Program Institute of Palliative Medicine at San Diego Hospice in United States of America in 2008-2010. We participated in Asia Pacific Hospice conferences since 2005 in Korea, in Philippines, Australia, Malaysia, Thailand, Taipei, Taiwan. We participate in international conference on palliative care in Canada, in China. And Mongolian Palliative Care Society organized 2 weeks palliative care educations for 3 doctors from Kyrgyzstan. And I organized training courses for oncologists of Kyrgyzstan on palliative care in 2014, bedside training on palliative care in Kyrgyzstan in 2015, training of national trainees of palliative care in Kyrgyzstan in 2017. In 2016, government delegation from Kyrgyzstan visited to study palliative care in Mongolia, visited Mongolia to study palliative care from Mongolia. In Agapa Hospice, organized palliative care training by support of Korean Church and Korean Medical University. And since 2015, Mongolia now is 28th country with good quality of death index by the International Economist and Intelligence Units. Within the low-income countries, Mongolia is the first country with good quality of death. Our dreams and future plan: no suffering in Mongolia. Make sustainable palliative care programs and services. Establish National Palliative Care Center with inpatient, outpatient, home care services, 24 hours phone and online consultation, education center for Mongolia and Central Asia. Help to develop palliative care in post-socialist countries. Develop voluntary palliative care services. And in the end, I want to say, I want to finish my presentation with logo of Mongolian Palliative Care Society. Life begins with love and should end with love. And I want, in the end, if I have time, to express my gratitude to all international organizations and people who support development palliative care in Mongolia. Thank you very much for attention. Thank you. Тууссан.
За одоо би зогсоо отох. Би нөгөө нэг сүүлд нь юу яах гээд жоохон каталж авах хугацаа үлдээх гээд.